When your doctor diagnoses a sinus or other infection, in most cases, antibiotics will be prescribed. Penicillin is one of the oldest antibiotic medicines, and at one time it was used for all infections, from a leg wounded in battle to pneumonia and everything in between. Bacterial resistance has limited its utility, and today the number of antibiotics could fill an encyclopedia. Unfortunately, allergies and suspected allergies to penicillin are also quite common. It's possible to be allergic to all kinds of penicillin or simply to certain types, such as amoxicillin or ampicillin. According to the CDC, 10% of the population believes they are allergic to penicillin class antibiotics. However, studies show that only about 1% are truly allergic. What are the symptoms of penicillin allergy? Well, common symptoms of penicillin allergy include shortness of breath, wheezing, chest tightness, swelling of the throat or tongue, hives, flushing, itchiness, nausea, vomiting, diarrhea. Penicillin allergies can truly range from mild to severe and life-threatening. Should I get tested for penicillin allergy? If you've ever had a reaction to penicillin, you could be at risk of suffering similar or worse reactions in the future. The benefit of getting tested for an allergy is that you know, one way or the other, whether you can take penicillin safely in the future. Imagine having to avoid the best or the only drug that works for an infection and not really needing to avoid it. This is something that we can bypass once we have that information. How is testing for penicillin allergy conducted? Well, first, a small and then larger doses of penicillin are applied to the skin with a skin test, provoking a controlled hive reaction in patients that are allergic. If there's no reaction to this, small and then higher doses of penicillin are applied under the skin with the same reaction of a hive in patients that are allergic. If this does not cause a reaction, a full dose of one of the penicillin class drugs is ingested by the patient, and the patient is observed for several hours. If they can do this, the test shows that they're not penicillin allergic. So what are the side effects of penicillin allergy testing? Usually just hives or a little temporary skin irritation where the test occurred. Rarely anaphylaxis can occur. Since this is an exposure that starts slow and increases slowly, it really is not as likely as we stop as soon as the reactions are positive. Most of the time, I undiagnose penicillin allergy, so typically nothing happens. How long does it take to be allergy tested? It takes 2 days of about 3 hours long, so a total of 6 hours. My preference is for the 2 sessions, but in emergency situations, the longer session of one 6-hour session is used. Can other drugs be tested? Yes, there's a protocol for just about every drug. That said, penicillin testing is the only one that is FDA approved, but this is more because drug companies choose not to go through the expense and effort of having their drugs tested for the sole purpose of indicating them for testing to allergy to them. Alternatives, if you're truly allergic to penicillin, in most instances there should be other antibiotic medications that work just as well. Avoidance is best if you don't know for certain. However, if you are allergic and a penicillin type medication is the only one that will work for your infection, desensitization can also be effective. So, what is penicillin desensitization? If penicillin is the only drug you can take, desensitization can be used to help you complete a course of penicillin class antibiotics. This means being administered penicillin first in very small, below allergic threshold doses and slowly increasing every 20 minutes until the full dose is being administered. So what's the disadvantage of penicillin desensitization? Once the penicillin is being administered at full doses, it needs to be taken regularly to maintain the desensitization without skipped doses. Therefore, the desensitization only works until the course of penicillin is complete. Once the course is complete and the patient has not been taking penicillin, the effect of the desensitization wears off and the patient goes back to being allergic and potentially having the same life-threatening anaphylaxis as before the desensitization. If you would like to be tested or treated for drug allergies, or you think you're a candidate, give us a call at 480-500-1902 or request an appointment online at relieveallergyaz.com/contact now.